Hello everyone. In this video, we will understand how to approach a case of abdomen pain, a very common disorders in the OPDs. So first we have to identify what exactly is the reason for pain. And the most important factor which will help us in determining the cause of the pain is the site. Ki where exactly patient is having pain. So these are the areas of the abdomen. If it is a right upper or right upper abdomen, the pain will be of cholecystitis. The features of the cholecystitis will be patient will have fever, patient will have that classical Murphy sign. Cholangitis, patient will have jaundice, fever. Pneumonia will be associated with cough, sputum, and signs of consolidation. Hepatitis, patient will have tender hepatomegaly along with icterus. Number two side, that is a epigastrium. The pain is usually due to peptic ulcer disease. If it is a gastric ulcer, it will be aggravated by food intake, and if it is a duodenal ulcer, the pain will occur sometime after food intake, like after 1 or 2 hours. Gastritis associated with burning sensation. Pancreatitis, the classical pain of the pancreatitis radiate to the back from the epigastric region. Myocardial infarction like inferior wall MI can also present as epigastric pain. So in any patient presenting with the epigastric pain, we should do ECG. Or a ruptured aortic aneurysm. Number third side, that is a left upper abdomen. The pain can be because of spleen pathologies like spleen infarction, rupture which is due to trauma, or abscess. Spleen abscess can be a primary spleen abscess and can be because of the embolism from infective endocarditis. Pain of the gastritis can occur at this site also, gastric ulcers. Now number 4 site, here will be the pain of pyelonephritis. So pyelonephritis, there will be a tenderness in the renal angle. Patient will have fever with chills. Ureteric stone pain can be here, which is can be colicky in nature, and it can radiate towards the groin area. It can be colitis like ascending colon inflammation. Same on the left side, pyelonephritis, ureteric stone, and colitis. While around the umbilicus, it is a classical and common cause is gastroenteritis. It can be a bowel obstruction or ruptured aortic aneurysms. While the number 7 area, that is a right lower abdomen, the pain can be of appendicitis, and the most important point of the appendicitis is that this pain will start from the periumbilical area and then it migrate to the iliac fossa. Inguinal hernia can be there, ectopic pregnancy, or it can be a nephrolithiasis, inflammatory bowel disease. Same will be on the left side, but the pain will be diverticulitis, and other pain will be similar like inguinal hernia, ectopic pregnancy, or nephrolithiasis and inflammatory bowel disease. While suprapubic area, the pain will be of urine infections like cystitis, or can be a urinary bladder distension. So this is a very important diagram to understand where exactly the pain is located. Depending on the onset of the pain, the second important point is whether it is acute pain or chronic pain. Acute pain, first assess whether the patient is in shock or not. If patient is in shock, 3 important pathologies should be kept in mind. Here we should go for a resuscitation of the patient's, urgent surgery referral should be done, and these are abdominal aortic aneurysm rupture, or it can be ectopic pregnancy or spleen rupture. So these are the 3 important causes where patient will present with shock. If shock is not there, then we will assess whether there are signs of general peritonitis like rebound tenderness. Nowadays rebound tenderness is not done. We do just a light percussion which will give us the similar information. So if the signs of general peritonitis are there, then we will go for a chest x-ray, and we will look for the perforated bowel or intestine or viscous fluid under the diaphragm can be seen here. general peritonitis features are not present, then we will look for the intestinal obstruction features, and if these intestinal obstruction features are present, then we'll get a abdominal X-ray done. So that will reveal us the dilated loops. If intestinal obstruction features are not present, then depending on the site of the pain, will make our diagnosis. So these are the sites of the pain, like acute pain, cholecystitis, cholangitis, hepatitis. Then epigastric pain, peptic ulcer, gastritis, pancreatitis, this we have discussed earlier. And splenic infarct, gastritis, gastric ulcer, pyelonephritis, ureteric stones, colitis, these are all acute pains. Gastroenteritis, bowel obstruction, periumbilical area, UTI, UBU obstruction, suprapubic area. And iliac fossas, appendicitis can be the important cause on the right side, and diverticulitis on the left side. So these are the causes of acute pain. Now come to the recurrent or chronic pain. So recurrent or chronic pain, most important feature is alarm features. So upper or lower GI symptoms are there with alarm feature. Upper GI symptoms like some episodes of hematemesis sometime, or upper abdominal pain is there. Lower GI symptoms like constipation, new onset of constipation, or altered bowel habits are there. So what are these features? These features are dysphagia, persistent vomiting, abdominal distension, or hematemesis. Upper GI symptoms, red flag signs, or alarm features. Lower GI features, alarm features are rectal bleeding, palpable rectal mass, or iron deficiency anemia, or change in the bowel habits, and age is more than 45 years. If any of these features are present, then we have to go for a upper GI endoscopy if upper GI features are there, or colonoscopy if lower GI symptoms are present, to rule out malignancies. If these alarm features are not present, then we will assess jaundice, abnormal liver function test, hepatomegaly, or ascites is present or not. So these features will help us in making a diagnosis of hepatobiliary cancers, or whether there is any chronic liver issues are present or not. If jaundice is not there, abnormal LFTs, hepatomegaly, ascites is not present, then we will look for the pain or mass or hematuria. If these features are present, then we are dealing with a case of renal cancer or autosomal dominant polycystic kidney disease. If these features are not present, then palpable mass, weight loss, or unexplained jaundice, palpable mass in the abdomen, if they are present, then we are dealing with a case of GI malignancy, GI cancers. If these are not present, then it can be a irritable bowel syndrome, one of the very important prevalent disorder in the community, or it can be endometriosis. So this flowchart is of a common and serious conditions that we should rule out or we should check for. Now, if any questions on this topic, you can put in the comment section. So this was about the general approach ki how should we make a diagnosis and when to refer the patient and what are the suspicious etiology or which system is involved. The most important feature will be the site of the pain. Now question for you, a patient presented with abdominal pain and this is the chest x-ray which is done. So look at this chest x-ray and tell me the diagnosis in the comment section ki what exactly is the etiology of this pain if the patient presented with this chest x-ray. Look it carefully. Now you can share your experience if you have if you are having these patients who are coming with abdominal pain, how you make a diagnosis, if there is any atypical cause of abdominal pain or any serious condition that you have diagnosed, so you can put that in the comment section. Thank you.